My name is Dr. Shoaib Javed Khan. I'm a consultant orthopedic surgeon at NASA Hospitals, Kasturi Nagar, Bangalore. Today we shall discuss a sports injury which took place in a young female who is about 38-39 years old. The name of the surgery is called ACL reconstruction, which is actually your anterior cruciate ligament. What we have done in this particular case is a patient who has had a slip and fall at home, had severe pain on weight bearing after the fall, had difficulties in complete extension and flexion of the knee, ultimately was advised an MRI, which reported a complete thickness tear of her ACL. When the patient came to us at NASA Hospitals, we advised her on the procedure, and we would like to also show you what an ACL reconstruction entails. The first step in an ACL reconstruction is harvesting the graft from the patient itself. So the most common graft used is a semi-tendinous graft, which we harvest, which will be shown to you in the pictures here. This case following which we can also use if the graft thickness is not as required or as we would prefer it to be. We can also add on a peroneus graft, or in some cases there are lots of debates on whether a patella graft is of better strength. So we have various options. We will also discuss this with the patient as to which option would be best suited for the patient. So the peroneus graft, the semi-T graft, or a patella tendon graft. So in the first step, we harvest the graft from the patient. You can see in this picture that the graft is being harvested from the same patient. The next step would be preparation of the graft, wherein we trim whatever is not required. We remove the muscle endings and make a clean graft, after which it is folded and prepared in addition to a particular type of suture. The next step would be to measure the thickness of the graft which is prepared. If this would be sufficient, at times we do add extra fiber tape if the graft is not thick enough. This is not very common, this is rare, but it does happen. If the graft is thick enough, we just measure the thickness of the graft to be inserted inside the tibia, and a different thickness inside the femur bones, which is the natural position of an ACL graft. We do not use the torn fibers of the old graft. In fact, we do trim it to make place for a new graft. Once the graft thickness is measured, we drill the bone accordingly to make place for the new graft. The graft is then inserted into the canal which we have created, and in order to hold it well enough, we do place a screw, which again has two different types of materials which are most commonly used. We have one which is metal and one which is bioabsorbable, which later on gets absorbed into the bone over a duration of time. The wounds are then cleaned and then sutured close, and the patient, in majority of cases, is made to walk the very next day. At times we do advise against folding of the knees, which is operated for a certain number of days, but even that is initiated after a certain duration of time, and the patient returns back to all normal activities within as less as 4 to 12 weeks. Please come visit us at NASA Hospitals, Kasturi Nagar, Bangalore, if you require any assistance in relation to your sport injuries. Thank you.